Hi, I'm Jana, and I'd like to go over your post-op instructions for the next week or two. And you'll be going home with your post-op bag, and we'll have all the things you need to take care of your newly transplanted grafts. So the first thing that we would like you to do is use of the ATP, liposomal ATP spray. So what you're going to do for this, for the first 48 hours, is to spray the recipient area. Give your recipient area of your head a fine mist, like this, every half hour. If you can keep the bottle cool, that's optimal, but if you can't, it's still great. It does help you get rid of the redness sooner and help you with the recipient area, have that part heal a lot faster. So please do use it and make sure you use it for the first 48 hours especially. If you still have some left, you can still spray 4 or 5 times throughout the day until it's gone. But like I said, the first 48 hours is the most critical. The donor area you don't need to worry about with the spray. You're going to be putting on bacitracin ointment. So put that on all through the back after your shampoos. We're going to put it on for you before you leave at the end of the day, so you don't have to worry about that when you get back to your home or to the hotel. But after the next day, if you come in for a shampoo, we will put it on for you, but all your shampoos after that, you'll be putting the bacitracin on in the donor, and then the spray for the first 48 hours in the recipient area. Okay, the next thing on the list on your instructions is cleaning and shampooing. You will, in your post-op bag, you will get a shampoo. It's a graft site shampoo. It has copper peptide in it, so it's really good for healing. And you'll need a plastic bowl or a cup that you have in your home to take with you to the shower. And what you want to do is have lukewarm water, fill this up, and take as many bowlful or cupful as you need to wet your hair. And then take the shampoo and emulsify it in your hands first, and then just gently dab it on the recipient area, or just like on here, if you have somebody helping you shampoo, just let the suds sit on there, and then you can work on your donor's area. And what you want to do is lather up a little bit more shampoo, go in a circular motion, and do the shampooing, massaging the donor area too. You want to keep that scab free, and then take some more water and just rinse it and until all the shampoo is thoroughly gone. That's the shampoo for the first 7 days. And then after that, you can go underneath the shower water, get your hair wet, and again, use the shampoo, emulsify it in your hands. And instead of just patting it down, you can begin to lightly massage the scabs so that you're helping the scabs gently wash away, so that you'll be scab-free within the next 3-4 days. You don't need to worry about the grafts coming out. The grafts will adhere thoroughly after about 5 days. So after a week of being gentle, the second week you can be a little bit more aggressive. Do that for the next 4 or 5 days, then you should be scab-free. Once you're done shampooing, we would like you to apply for the first 5 days a bacitracin ointment on the donor scar line. This ointment does not go on the recipient area, so please use it only on the donor scar. So just open up the little pack, and as soon as you're done shampooing, lift up the hair away from the scar line and just dab. If you have a Q-tip or if you have somebody else helping you, it's best to use that instead of your fingertips. But apply that for the next 4 or 5 days after your strip procedure, and your scar should be healing up nicely.
Great.
Okay, the next thing on the list is ROGAINE foam. Many patients use the ROGAINE foam before surgery, and we do ask them to stop during the surgery for a couple of weeks. If you are going to start on the ROGAINE foam again, we ask that you wait 2 weeks after surgery, between 2 to 3 weeks, so that it doesn't irritate your skin. Okay, next on the post-op instructions is exercise and activity. For the first week, we definitely want you to be very careful about the grafts. We don't want you to sweat, and especially when you do a strip procedure, we don't want you to put a lot of undue stress on the donor scar. We want you to have a nice fine line scar, so one of the ways is to be careful not to do any type of torque movements on the back of your neck, any kind of stress that you put on the back of your neck, refrain from doing those type of motion and just take it easy. You can certainly do a light exercise after the first week. And you can, after 2 weeks, you can for sure go back to your normal exercise routine. Okay, next on the post-op instructions is hair coloring. You do not want to hair color after surgery, so if you can do that prior to surgery, that's best. But if you need to, if you're used to doing hair coloring, do it 2 months after surgery so that it doesn't hurt your grafts that were just implanted. Okay, next I'd like to discuss attire after surgery. We would like you to wear a button-down shirt so that you don't accidentally pull out any grafts. So for the first 3-4 days, we'd like you to wear a button-down shirt. The other thing is to wear a hat. If you're going to be out in the sun, or if you like to cover up the work, for the first week, we'd like you to wear a baseball hat or like a surgical cap. Okay, like this, and I will demonstrate how to wear a ball cap. We would like you to take care of the bill of the cap first. So you want to hold this down and then gently bring back the back so that it's laying on the head without pulling any grafts out. And then to remove that hat, we'd like you to hang on to the bill again and then pull up so that you take the back off first and then take the hat off thoroughly. This time I'd like to cover bleeding, just in case you happen to bleed slightly overnight. And it's not uncommon, so don't worry to bleed just a little bit. So you will, in your to-go-home bag, you'll have a couple pillowcases and some sterile gauze. So if you notice that you're bleeding slightly in the recipient area, take a couple gauze out, fold it in half, put it right on the spot that's bleeding. Put an even pressure on there. We don't want you to use one finger and poke any other grafts surrounding that bleeding area. So just hold a light pressure for about a minute or two and the bleeding should stop. In the donor area, since the incision line is so much bigger, hold the pressure for a good 5-10 minutes. If you continue to bleed and you notice that it's still bleeding after 5-10 minutes, call the patient care line. If you can't get a hold of anyone there, probably call the emergency. Okay, next we're going to cover swelling. In your to-go-home bag, you'll have a couple ice packs, and we would like you to put them right away into your freezer if you have one. If you're staying at a hotel, put it in the ice bucket. And we do give you 2 so that you can alternate between the 2. And what you do is, in the evening of the surgery, when you're home or at the hotel, take the ice pack, and you don't want to put it on your recipient area, but just on the forehead. And note that you're going to need the ice pack for the first 3 days, but if you swell, it's not going to show up for 72 hours. So just because the next day you don't see any swelling, it doesn't mean that you're out of the woods. Continue to ice 4 or 5 times throughout the next 3 days after surgery, and you'll minimize your chances of swelling. Okay, next is swimming in sun. We would like you to avoid swimming in swimming pools or the ocean for the next 10 days. Also, the sun, you do not want to get your recipient area sunburned, so wear a ball cap, or if you need to spray a little bit of suntan lotion, you can do that, but avoid getting it sunburned. The next is alcohol. Please avoid drinking any alcohol, especially the first night after surgery, because you're going to be on pain meds, which is a mild narcotic, but we do not want you to mix the two. So avoid, especially the first night. Next is cigarette smoking. There are a lot of studies that show that cigarettes is harmful for wound healing. So if you can refrain from smoking at all, that's great. But if you are a regular smoker, if you can cut it down, especially for the first couple months, that's best. But if you can cut it out altogether, obviously that would be best for you and the grafts. Okay, next on the list is numbness. Numbness after strip procedure is normal, and it will resolve itself in 6 to 8 weeks. But there are instances where it can last to 6-7 months after surgery. So don't worry, and it will get back to normal in time. And the other thing I'd like to cover is suture removal or staple removal. This should be done 10 to 14 days after surgery. If you're going to be in a different state and you're not able to come here for your suture removal, there are some instances where I can help you find a location, another hair transplant doctor that can help you remove the sutures or staples. But you will get a suture removal kit in your to-go home bag that you can bring with you to someone who's a medical professional or another physician who can do that for you, such as your...
Hi, I'm Dr. Joe, and I'd like to go over a few more things before we let you go. The first of them is folliculitis. Now, most patients do get a little bit of this folliculitis, and it can occur anywhere from 2 weeks up to 6 months even. And basically what it is a little bit of irritation in the recipient area, which can cause a ingrown hair, and you can develop a pimple-like lesion that can sometimes be a little tender. Most of the times what we recommend first off is to make sure you're cleaning your hair with shampoo on a daily basis. This will help prevent a lot of these. Also, if you are having a few of these pimple-like lesions that are tender, you can try some warm compresses for a few days to try to alleviate that. And you can also add a little bit of antibiotic ointment to any of the worst offending lesions. Now, if you do see that they're not really going away, please give us a call, and we can always have you come on in so we can take a look. We may even decide to call in a prescription for you if we find that that's necessary. Now, we have in your to-go bag, we have given you some prescription medications called tramadol, and you can take these for any types of pain that you are having during the next few days. A lot of patients decide to take this at bedtime to help them sleep. But for the most part, we advise you to not use any alcohol or to drive while using this medication. Much more common medication to take for the next few days would be extra strength Tylenol or ibuprofen, as these medications do help quite a bit, and you can use them during the day or at work. Now finally, in your to-go handout, which contains all the information that we went over with you, there is a list of numbers that you can call if you have questions. The patient care line is the first number you'd like to try. There's also the number of your physician that you worked with, and we'll be happy to answer any questions that you might have. Have a great day. Thank you.